Hi, I'm Christine Lee. I'm a gastroenterologist at the Cleveland Clinic, a director of endoscopy at Cleveland Clinic Willoughby Hills Ambulatory Surgical Center. What is diverticulitis? Diverticulitis is best explained by first explaining the word diverticulosis. Diverticulosis is a condition where the colon wall lining has a weakened part where it pouches out. The best analogy is to equate that to a highway, where the highway has a pothole. So diverticulosis would be that little pocket that's formed from a defect or weakening in the colon lining. Diverticulitis is one step above that. So when something is impacted and it's stuck and it gets inflamed, then that condition is then called diverticulitis. What are the symptoms of diverticulitis? The symptoms of diverticulitis most commonly would be abdominal pain, cramping, bloating, changes in their bowel habits, even bloody diarrhea, fevers, chills, nausea, or vomiting. What should you do if you suspect you have diverticulitis? First thing is to just kind of tamper down on your physical activity. Take it easy. No heavy lifting, no strenuous exercise. Just kind of lessen the intensity of your physical activity for the day. And two, your diet. You might want to switch to a soft diet or a mechanical soft diet, like mashed potatoes, soups, broths, applesauce. And then thirdly, make sure you're hydrating well. So take a lot of fluids, hydrate your body, and get plenty of rest. Are there any medications that you should or shouldn't use? Medications you might want to avoid up front would be any antidiarrheal medication. You certainly don't want to block up anything. You want to actually provide relief. So I would certainly stay away from the antidiarrheal medication. And I would also advise staying away from pain medications. You really do want to follow your symptoms. You want to make sure your symptoms are not intensifying or getting worse. And if you're taking pain medications, you might not be able to get an accurate assessment of your pain, whether it's getting better or worse. So I would try to stay away from those in the initial stages. If it's really uncomfortable, you could take over-the-counter medications that would be more soothing, stool softeners, non-stimulant laxatives, any medications that kind of be more soothing and help eliminate the waste. What foods should you stay away from if you have diverticulitis? In the olden days, we did recommend no nuts, no seeds, no popcorns. However, we've now known that when nuts and seeds are well chewed and properly ingested, they actually have a lot more helpful components than harmful. So we no longer advocate avoiding nuts and seeds, and we actually encourage eating a high-fiber diet, nuts and seeds included. Now, popcorn still remains very controversial due to the fact that some people accidentally or inadvertently swallow the unpopped kernels, and those could be a little bit of a problem when impacted in the diverticulum, exacerbating diverticulitis symptoms. When do you know when it's time to seek help? No one knows your body better than yourself, so when any symptoms arise, however small, if it's new to you and concerning or bothersome to you, then it is time to get that assessed or at least evaluated. That being said, the classic alarm symptoms that we often advise patients to look out for would be persistent pain that intensifies, fevers, chills, blood in your stool, unexplainable weight loss. Those kind of things are classic alarm symptoms, and you probably should seek medical attention sooner than later. If in doubt, have it checked out.